Welcome to the 2026 Medicare Basics. This is part 3 of our recorded series. In this section, we're going to discuss Medicare Advantage plans, Medicaid, and a little bit about fraud. This presentation is brought to you by the SHIP Medicare Counseling Program. We're part of the State Health Insurance Assistance Program. You can reach us by calling 303-441-1546 or send us an email at medicare@bouldercounty.gov. If you leave us a message, please also include your email. Thanks, and we'll get started now. Just a review of what we're going to be covering in Part 3. Part C, Medicare Advantage plans, Medicaid, and the Medicare Savings Program, fraud, and a little bit about how to prevent it. If you want to know more about Medicare enrollment, you would go to Part 1 of the series. Part 2 is in which we cover all of original Medicare. In part 2, we talked about original Medicare. So we were kind of over here on this left-hand side of the chart. Now we're going to look at a completely different way to review or to receive your Medicare coverage, and that's going to be through a Medicare Advantage plan, which is also called Part C plans. In a Medicare Advantage plan, you also enroll in Medicare Part A and B first through Social Security, and then the Advantage plans, they're kind of an all-in-one plan. They include your drug coverage, they may have some extra benefits, and the cost may be a little bit lower if you have a Medicare Advantage plan. Part C Medicare Advantage plans are provided by private insurance companies who contract with the federal government to provide your Medicare services to you. So these plans, they have to provide all the services that are provided by Medicare, but then the plan's going to determine the cost. They will include your Part A inpatient hospital benefit, your Part B medical, and most of them include Part D prescription drug coverage. Medicare Advantage plans, also known as Part C plans, are sold by private insurance companies who contract with the federal government to provide your Medicare services to you. To enroll into a Medicare Advantage plan, you must also be enrolled in Medicare Parts A and B. So you have to have both A and B. You have to pay the premium for your Part B benefit of $202.90 to be enrolled into a Medicare Advantage plan. Most of these plans, you have to live in the plan service area and receive all your services through the plan. So our service area is Boulder County and the Denver region. Most of these plans require that you see a primary physician and then get a referral to see a specialist. Good portion of them are HMO plans or HMO POS, which stands for point of service, and that point of service varies from plan to plan on what that means. And then there are quite a few PPO plans. A special needs plan is for people who have both Medicare and Medicaid, or they have a chronic condition that qualifies for them for that special needs plan. So there's 4 different variations of types of plans that you can enroll in. But you do want to make sure that your doctors accept the plan and that you understand what your copays and your coinsurance costs are going to be through that plan, because each plan is going to set their own fees for services as you access those services. Medicare sets the maximum out-of-pocket limit each year that the plans can charge, but many plans are well below the limit that Medicare sets, which this year is $9,250 for in-network services. So these plans, they have to cover all the services that are covered by Medicare. The plan's going to determine the cost and whether or not you need pre-authorization, referrals. So it's important that you understand the plan that you're enrolling in and how to access your services. There are a lot of different Medicare Advantage plans to choose from in Boulder County this year. 34 of them. So you've got lots of choice. As you can see, these are the companies that are offering plans this year. Each one of these companies has multiple choices, or most of them do anyway. If you look at Humana, Humana has 10 different plans to choose from. That's a lot of choice. What are the differences between those 10 plans? This is where the devil is in the details, and you really want to understand how your plan works, what it's going to cost you as you access benefits, and make sure that your doctors and your facilities are going to be in the network of the plan. What are the enrollment periods for Medicare plans? Well, you have your initial enrollment period. That's when you are turning 65, and it's the 7-month period that's surrounding your 65th birthday. The 3 months before your birthday month, the month of your birthday, and the 3 months after. You can enroll into an Advantage plan. That plan will start the first of the month in which your Medicare starts. You also have the opportunity to change your Medicare Advantage plan every year during the annual enrollment period, which is October 15th to December 7th. If you make a change during that period, the new plan or coverage will begin on January 1. So during that annual enrollment period, you can join, switch, or drop your Medicare Advantage plan. We have a note here on the bottom of the slide about 5-star Medicare Advantage plans. If a company or a Medicare Advantage plan is given a 5-star rating by Medicare, they are allowed to process year-round enrollments by Medicare. Unfortunately, we do not have a 5-star rated plan this year in Boulder County. We're hoping we will have one next year. So what is it going to cost you to be enrolled in a Medicare Advantage plan? First, you are going to be paying your Part B premium of $202.90 per month. That's the Part B premium in 2026. Everybody pays that, even if you're enrolled into a Medicare Advantage plan that has a zero premium. So it doesn't cost you anything to be enrolled into the Medicare Advantage plan. No additional costs, but you're still going to be responsible for that Part B premium. We have had people fight us on that and say that, no, I was told that I'm not going to have to pay anything, that it's going to be zero. Well, we're here to tell you that you are going to be paying your Part B premium even if the plan doesn't have a premium to be a member. So there is a wide range of premiums in the Medicare Advantage plans. They're anywhere from zero monthly all the way up to $189 per month. A good portion of them have no monthly premium or very small monthly premium. We would not suggest that you enroll in the $189 plan. That one, you're basically buying down your maximum out of pocket with your monthly premium payments. So in these plans, you're still going to have deductibles, coinsurance, and co-payments, and those are going to vary from plan to plan. Each company and plan decides on what the costs are going to be as you access services up to the maximum out-of-pocket limit. So it's important to understand that when you enroll in the plan. The note there we have again about the 5-star plans. We don't have a 5-star plan in 2026. Medicare Advantage plans are given star ratings by Medicare, and they're based on what you see down there on the slide. Stay healthy programs, how do they manage people's chronic conditions, what's your experience like, what happens when you call customer service, and what is the plan's performance, how do they tier their medications and offer their services to you. Most of the Medicare Advantage plans have what are called value-added incentives. These are the extra benefits that you see advertised on TV all the time. They're what people are talking about, that they get to do all of these things at no cost. Almost all of them include a gym membership. They're called different things: Silver Sneakers, Renew Active, Silver and Fit. But that can be worth $400 to $600 a year if you're having a free gym membership. A lot of them have what are called OTC cards. Those are over-the-counter cards that allows you to purchase product either online and have it shipped to your house, or maybe go to Walgreens, buy Band-Aids, Tylenol, Advil. They give you usually a quarterly amount that you can spend, and that amount does not carry over if you don't use it. So it's kind of a use it or lose it each quarter. A lot of people really like that benefit. Some plans have transportation, mostly if you have both Medicare and Medicaid benefits. These plans offer dental, vision, and hearing. Those benefits can be limited. Just depends on the plan and who's in network with their plan. But if there is a dental benefit, you want to make sure that you're using an in-network dentist and you're getting your services pre-approved. Vision usually works pretty well, covers a vision check and hardware, and it'll vary from plan to plan. One plan may give you 100 towards your vision services, another may give you 300 towards your vision services. So this is another reason why you really want to look at the details of the plan and understand what they cover when it comes to the extra benefits. Don't join a plan for the extra benefits. Make sure that you're joining that plan because it covers your medical coverage first, and then take a look at the extra benefits. If you have a Medicare Advantage plan, you're still going to have deductibles and copayments for services, and you cannot purchase a Medigap to pay those fees. Mostly you have to stay in network with these plans. So you're choosing a way to receive your Medicare coverage. You're either going to stay with original Medicare, or you're going to enroll into a Medicare Advantage plan in which you're going to receive all your services through that plan. We like to tell people to shop these plans carefully. Make sure you understand, are your providers in the network? Do they accept the plan that you want? Do you understand what you're going to have to be responsible for, what your co-payments are and your co-insurance costs are? Understand how the plan works. What's the maximum out of pocket? I think when you're looking at Medicare Advantage plans, you really have to pay attention to, are my doctors in the network, and what's my maximum out of pocket? So if everything in my world turns upside down, I understand what I'm responsible for. So in part 2, we had this same slide on moving from original Medicare to a Medicare Advantage plan. Now we're going to take a look at it from a different viewpoint. How easy is it to move from a Medicare Advantage plan back to original Medicare with a Medigap in the future? Well, this can be a little bit more difficult. The reason being that if you're not in a guarantee issue period, the Medigap company, they can and will provide you with a medical questionnaire, and depending on your answers, they can deny you coverage or charge you more. So you can move from a Medicare Advantage plan back to original Medicare during the annual enrollment period, which is October 15th to December 7th. For a January 1 start, and the way to do that would be to enroll into a standalone prescription drug plan. That would pull you out of the Medicare Advantage plan. Come January 1, you would have A, B, and a Part D plan. But keep in mind that you're going to be subject to medical underwriting for the Medigap plan, and you have the possibility of being denied that coverage based on your answers to the questionnaire. So if you're thinking about doing this, moving from Advantage back to Original, I would say start exploring whether or not you'll pass that medical underwriting probably sometime in September. And feel free to call us with questions. We can talk to you about this. Now, we can't leave you without talking about programs for people with limited income and resources. I'm sure there are a lot of people that have been listening to this 3-part series and are completely freaked out by the costs. So there are programs that can help you cover the Part B premium of Medicare, and possibly the copays and the coinsurance costs. This is Medicaid and the Medicare Savings Program. Medicaid is a federal state health insurance program. It's for people that have limited income and resources, some people with disabilities, and if you're eligible, it can pick up your health care costs and your prescription drug coverage costs under the age of 65. You would have Medicaid. Eligibility is determined by Human Services. There are offices in Longmont, Lafayette, and Boulder. You can also apply online. Website is there below. The Medicare Savings Program is for anybody that has Medicare. It can help pay the Part B premiums, and it may also pay the deductibles and the coinsurance costs depending on your income. We do have an eligibility sheet that's available on our website. Take a look at that, and you can self-screen yourself. We can also help you screen to see whether or not you're eligible for the Medicare Savings Program. We're happy to do that. We don't do eligibility, but we can tell you based on your income and your resources whether or not you might be eligible and should apply. Extra Help is a Social Security program that helps cover the premium and lower the copays for prescription drug plans. There's a monthly income and resource limit. To qualify for this program, you'll see what it is there for an individual and a couple. We are happy to help you complete these applications. We do them all the time. It takes about 10 minutes to do online. And then Social Security will send you a letter and let you know whether or not you're eligible within about 10 days of submitting that application. Enrollment period restrictions for people that have extra help don't apply. So if you have extra help, you can switch your Part D plan every month throughout the year. So that's kind of a nice added benefit. Okay, now we want to talk a little fraud because this has become a $70 billion a year problem for Medicare. And every time there is fraud, and Medicare loses money, it costs all of us more. Our costs go up in order to compensate. So what is at risk here is your personal information, your Medicare benefits, your financial security, and your health and your medical records. The common fraud tactics that are used, number one is emotional manipulation and creating a false sense of urgency. They try to get you to act without taking the time to think it through. So if they can get you anxious or feeling upset or that you might be losing something if you don't act right now, that is their sweet spot. They're going to try offering you services that are free or one time or it's exclusive, and they may apply pressure. We've had people that receive calls before where sometimes the agents or whoever it is on the other line trying to get their information starts yelling at them. I mean, that can kind of rattle you, and we want to make sure that you just take the time to take a breath and think about what's happening before you commit to anything or provide any information. We've added this slide about artificial intelligence because it's kind of become a big deal, and it's a scammer string being able to use AI. So really seeing and hearing is no longer believing. That's what we want you to know, because they can mimic people's voices, they can fake videos, they can make the emails look real. Um, you're going to need to independently verify everything. If somebody says they're calling from the doctor's office, just say, you know what, I think I'm going to hang up and I'm going to call my doctor's office directly. Don't accept unexpected calls. You know, if somebody says they're calling from Medicare, know that Medicare doesn't call you. Social Security and Medicare, they mostly communicate by mail. Don't give out your personal information to strangers. Somebody says they're like that example again. Somebody says they're calling from your doctor's office and they want to verify your information. And they may give you a number and you say, oh, that's not my Medicare number. And then you go ahead and give them your Medicare number. Don't let them trick you into it. And make sure that you are not giving out your personal information to strangers. Medicare is not going to threaten you. They're not going to pressure you. They're not going to call you. Just take the time to think about what you're listening to, what you're seeing, what you're hearing, and go out and verify it independently. Hang up if they're calling you. Um, Shut the door if somebody's knocking on your door that you don't know. It's not rude to be shrewd, is what we like to say. And then go ahead and pause before clicking on any links. There's lots of scam emails, so you can hover over the email address to see what the actual email address is. You can hover over the link in an email. Basically, if you're receiving a link in an email, you're going to want to make sure you don't click on that link unless you know it's from a trusted source. And then delete any messages that seem unusual or that are pressing you for information or that have that sense of urgency. I know we all get those text messages. What's the one that came out most recently about, I think I got a text message saying, that I was going to be arrested and I needed to pay my court fines for parking fines or something like that. Um, and that's a total scam. So just trust your instincts. If it feels off, it probably is. So these are just a few of the ways that you could help protect yourselves. Update your passwords. I think the Community Protection Division of the District Attorney's Office will tell you that you need to update your passwords once a year. I know I have a tendency to keep mine for years, so that's something I need to do myself is update those passwords. Do a privacy checkup on your social media accounts, review your privacy settings, review bank accounts and your Medicare summary notices, log out of your apps so that you don't have any unauthorized access and delete ones that you're not using. Take your social security card out of your wallet. Most of the time you don't need to have that with you. And then just make sure you verify everything. Once you have Medicare, you will receive what are called Medicare summary notices, or if you're in an Advantage plan, you'll receive an explanation of benefits. On that statement is going to show the information on services you've received, doctors and services. Check through that statement and make sure that everything looks okay. If there's something on there, for instance, we had a woman who received her Medicare summary notice and it showed that she was billed for a prostate exam. She called her doctor's office. That was just a coding error by the billing office. They corrected that very quickly. So if it's something like that that's just a coding error, try your doctor's office first and they'll recode it properly and rebill it. If you think you've been a victim of fraud or you think you've given out your Medicare number or some information that you shouldn't have, please do give us a call because we are also senior Medicare Patrol certified counselors in the prevention of fraud. So we can collect that information and pass it on to the state office who will then, if they have enough information, pass it on to the Office of the Inspector General and try to go after them. Don't give out your Medicare number. Our tagline here is it's not rude to be shrewd. We've all been taught to be polite, so a lot of times when people call or they send information, we're trying to be polite. Just don't worry about hanging up or not giving somebody information. And always verify the source. So if you're getting a call, call that person back directly. Call your doctor's office directly. Call the supplier directly and ask if there's something they need rather than giving it out to a random person that has called and said they're calling from Medicare. If you have any questions about this, please don't hesitate to give us a call or to call 1-800-MEDICARE. We do have appointments available every week, so we're happy to talk to you. We've got lots of counselors that are standing by on the ready. Everybody is state health insurance program certified to counsel you in Medicare. The bulk of our appointments are Tuesday, Wednesday, Thursday, and we do them by phone or Zoom or in person. If you want an in-person appointment, the locations are in Lafayette, Longmont, and Louisville. So it just depends on the day and the time. But if you'd like to schedule an appointment, just call us at 303-441-1546. Please do include your email address so we can try to avoid playing phone tag and get you scheduled as quickly as possible. You can also send us an email at medicarecounseling@bouldercounty.gov. And on this slide, just one last time, is our information for contact. We are the only SHIP counseling program in Boulder County. So we'll provide you with unbiased information, education, and facts and help you navigate the process. Or if you're having any issues with your current Medicare benefits, just give us a call. Thanks.